Hey, future medics. Today we are finishing that axial skeleton and we are going over the thoracic cage. Now, this is important because it protects vital organs and plays a huge role in breathing. So, this is the last of this part. Let's finish it up strong. The thoracic cage is made up of 12 pairs of ribs, the sternum, the thoracic vertebrae, and the costal cartilages that connect the ribs to the sternum. The job of the thoracic cage is to protect vital organs, the heart, the lungs, and major blood vessels. It also provides structure for the thorax so when we're breathing, nothing collapses down. We divide the ribs into three groups. You've got true ribs, which is sets 1 through 7, false ribs, which is 8 through 10, and then floating ribs, which is 11 through 12. Now, the true ribs attach directly to the sternum in the middle. False ribs don't directly attach, but they are tacked together by a common costal cartilage, which attaches them to the sternum, but they're further down past where the sternum stops. So they have to be connected through cartilage. And then the floating ribs do not connect in the center at all. They only connect in the back at the thoracic vertebrae. So because they only have the one attachment, they're definitely a lot less stable, which allows them to be really vulnerable during trauma, and they can be pushed back and penetrate and puncture the liver, the spleen, organs beneath it. Looking at the sternum, it is broken into three parts. You have the very top where the clavicles attach is the manubrium. And then the bulk of the sternum is the body, and the very tip point is the xiphoid process. Now, you may have heard of the xiphoid process before because this often comes into play during CPR. Sometimes if we get CPR way too low and we don't have it midline of the chest where it's supposed to be, we can be doing compressions over that xiphoid process. And it's pretty small and not super strong. And so it can actually be broken off and it can puncture the organs below it, the heart, the lungs, things like that. That is a problem. So it's really important your positioning when you are doing CPR. The space between each rib is the intercostal space. Here you will find intercostal muscles, which help us breathe in really deep and breathe out. You'll also find nerves, arteries, and veins. And this becomes important when we're doing needle decompression for collapsed lungs because we want to make sure we go over the rib and not under so that we don't catch those vascular structures. Now, when we're talking about rib injuries, it is a thing to keep an eye on because what can happen is whenever we fracture a rib, it hurts to take a deep breath because those muscles are pulling on that fracture. So your patient will take very shallow breaths, which can lead to hypoxia, and they might need supplemental oxygen. So keep an eye on that. But also, these are bones, and they can move posteriorly and slice up a bunch of vital things. So it's very important to palpate, see what's going on, and make sure you keep a close eye on them. Now, a flail chest segment is when you have 3 or more ribs that are broken in 2 places. So they will break and make their own free floating section that will move opposite of the rest of your ribs when you're breathing. And so it's pretty easy to spot, but having enough force to break ribs like that can be a pretty good sign that there could be a pretty serious underlying lung injury. Here's a few things that you're going to look for on your patient assessment. We're going to look for crepitus on the rib cage. We're going to look for paradoxical movement, but shallow respirations, pain with breathing, them guarding around that rib cage. We're going to take these really seriously because on the left side, aside from the lungs, ribs can puncture the heart, but also the spleen. And on the right side, we can see liver damage. So of course, we're going to keep a very close eye on these. And if we have a lot of rib fractures, or we even, God forbid, have a sternum fracture, which takes a lot of force, by the way, high index of suspicion for a hemo or a pneumothorax. That is the entire axial skeleton. We are done. You did such a great job. We took it video by video and built layers on layers, and now you've got them all knocked out. You're doing such a good job. Solid anatomy builds solid and confident paramedics. So let's keep this momentum going. I believe in you, even if you don't believe in yourself. I'll see you in the next section. We'll see you soon.